Good morning. It is finally Friday. It's July 30th. I'm Jessica Lovell. Welcome into the Morning Medical Update today. Today, we have Dr. Gary Morsch, founder of COVID Care Force. He has an urgent request of us concerning critical healthcare staffing shortages. So we are so glad to have you back, Dr. Morsch. It's also Follow-Up Friday, where we answer your questions that we couldn't get to during the week. But keep sending in your new ones. Jill's standing by for those. Also standing by, Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control here in the studio. And let's get to him now with our COVID count. Good morning to you.
Hi.
How are you?
I'm doing good.
How are the numbers doing?
Our numbers are holding steady. I think we're at 35 yesterday for active infections. We have 35 today as well. 17 in the ICU, 9 on the ventilator. Again, I don't think too much of that has changed. And remember, we do have discharges and admissions, but that number is holding steady right there. We still have 18 additional patients in that recovery period, so a total of 53. The ages for those range from 22 to 97. Unfortunately for Hays in our rural communities, Hays has 8 active patients. So we have seen that their numbers have gone up. Through this week, they have 1 on the ventilator, and per the reports, none of those patients are vaccinated. So.
Wow. So that rural number is concerning. Here
Yep.
locally, then what does that tell you? That we're staying steady? Is that good news at least?
You know, the cases continue to go up. We know that cases typically are, 7, 10, 2 weeks prior to hospitalization. So we are still kind of going to wait. We are prepared for more patients. We hope that doesn't happen, but we'll just have to wait and see what happens over this next 7 days.
All right. Thanks for the update. Let's get to some reporter questions on the line. All right, jump in if you have one. I do have one from Wayne with KLKC Radio. He had a couple of people call in with similar questions. This gentleman got his first vaccine. Unfortunately, his wife passed away during the time that he was supposed to get his second vaccine. By the time everything settled down, he missed his window. So let's talk about the window, because then another person said that he had gotten his first, and then there was some media talk that there were some complications with those who have had COVID. So some misinformation, missing a window. Dr. Hawkinson, tell them about the missed window. Can they go back and just get that second shot, or do they have to start over?
Yeah, so I would assume if we're talking about that, we are talking about the mRNA vaccines, both from Pfizer and Moderna. Yeah, that is totally fine to go later than those 3 or 4 weeks, depending on what vaccine manufacturer you're using. It is totally fine to go ahead and get that even after those initial 3 or 4 weeks. And in fact, some people have surmised, and they looked at further studies looking at later dosing of that second dose, and everything continues to look good. So please go get that second dose. That's really what is going to help boost now that specific immune response that has been generated from that first dose of the vaccine.
Because when we were first giving out the vaccine, it was really important that you hit your mark the day that you needed it. So again, just to clarify, if it's a couple of months, several months out, it's okay. Just get the second shot.
Absolutely. Yep.
Got it. All right. Other reporter questions on the line today? Okay, jump in if you have them. But Dr. Morsch is here. He is the founder of COVID Care Force. So we, again, so glad you're back with us today. How are you?
Yeah, I'm doing great. Thank you.
All right. So first, just tell everyone what COVID Care Force is and how did this all come together?
I practice as an emergency medicine doc, and so been doing that for 25 years. And also have a master's in public health. So I always pay attention to the health at large globally. And I was traveling in Asia last January and February and saw this happening, this COVID starting to take over. And as I traveled back to the U.S. a couple different times during those few months, there was very little screening done. And I was thinking, this could be really bad. And so in March, I decided I've got to be all in. I've got to throw everything I have at this virus. We got to stop it. I knew there are a lot of great organizations that are working to get volunteers. One of them is an organization I helped found, Heart to Heart International, and everybody was working hard. But I decided, why not have a separate, dedicated organization that does nothing but mobilize healthcare volunteers, doctors and nurses, respiratory therapists, and recruit them and send them into hotspots, maybe for a few weeks at a time, maybe a month at a time, whatever would be needed. And so I incorporated and founded a new not-for-profit, COVID Care Force. You can find it online, COVIDcareforce.com. And since that time, we've sent approaching 100 teams, medical teams, to 30 different places around the United States and Mexico, from New York to San Francisco, from the Crow Nation in the north and the plains, down to the Navajos, into Oklahoma, the Chickasaw Nation, and throughout Mexico. And even today, we have teams on the ground. And of course, I thought, like we all were, hoping that COVID Care Force was going to perhaps be a footnote to history by now. We had these wonderful vaccines, and it seemed like we were getting ahead of it. And I was telling my staff we're going to transition to Global Care Force, and we'll be volunteering, but it won't be so much for COVID. Well, all of us know the rest of the story. COVID is back, and probably it's going to be back probably worse than it was before, perhaps. Dr. Hawkinson, I'm sure, has some ideas on that. But we're preparing for it's probably our third wave of volunteer mobilization. And so we need volunteers, healthcare professionals, to come to our website and sign on so that we can be ready to go. And we're already getting calls from many, many hospitals that they need help in their staffing.
And we're going to put that information up on the screen here in just a moment. It'll be in our Facebook comments as well. But I was going to ask you what the response was, and it's clear it was huge. And there were a lot of people, I think, during COVID asking themselves, how can I help? You felt very, isolated.
Right.
There's not much you could do. We didn't have a vaccine. So this seems like kind of the perfect answer for that. We know that there's that feeling for all of us, like, oh my gosh, here we go again. Your teams must be feeling that too, right?
Here we go again. It's hard to believe. I mean, it almost feels like it was at least a year ago in April in New York City. The rest of the country was really doing pretty well, and it slammed into New York City. And I know there was that feeling like, oh wow, that was kind of the first wave. And then as it spread throughout the United States, we really got busy then in May and June, and then we have been busy ever since. Although we thought we were starting to finish, we were getting slower, fewer and fewer people out, fewer and fewer requests. But now, here we go.
Yeah,
again.
not so fast.
No doubt, not so fast.
Right. So how might the deployment look different this year? I would imagine the vaccine is going to have quite an impact. That's good news. But I'm sure you learned a lot from this past year. How might it look different?
Well, one of the things that was very different is when we first started over a year ago in April of 2020, the vaccines weren't available. We were not able to get vaccinated. So our volunteers knew when they went into, whether it was New York City or Mexico City or working with the Navajo Nation, we knew as volunteers that there was a good chance we might catch COVID. And because it's a serious disease, some might even die. And I would, so you just had to be prepared to understand this is a very serious thing. Well, fast forward a year, a little bit more than a year, and vaccinations are prevalent. And I dare say there's not anybody that volunteers with us that is not vaccinated. In fact, we would be very careful probably not to accept a volunteer if they were not vaccinated. So that's given us a lot of comfort. Now, we know with the Delta virus out there, we're not out of the woods yet. One of my medical director, even yesterday I was talking to him, and he and his wife and children who had been vaccinated months ago all just recently went through a round of COVID, even though they were vaccinated. However, some were asymptomatic, and some, of course, none of them ended up in the hospital. So the great thing we can say about the vaccines is there's very little chance you're going to have a serious illness, even if you should get COVID again, particularly the Delta variant.
And we're showing some of these pictures. These are some of your teams
right
out doing their work.
Right. And I have to say that I think what I'm most proud of with our volunteers is the partnerships we built with Native American communities, our Indian reservations. It was it's not something that I paid a lot of attention to over the years, but our Native American communities, our Indian reservations, got hit very hard, very fast. We jumped in, helped them treat, test, and now vaccinate, of course, tens and tens of thousands of their tribal members, and they were able to reach herd immunity very quickly. In fact, the Navajo Nation was the first group in the United States to reach herd immunity. They passed the 70% mark of vaccinations months ago.
Why is that? You say they did it right.
Well,
what is it? What are the Native Americans doing that we all need to be doing?
That's a good question, and I don't want to be political, but it's a sense of respect of elders, respect of their tribal leaders. Surely many of them might have disagreed with the some might call draconian measures that they instituted, but early on, again, before there was a vaccine, they required masking. And then on the weekends and at nights, they had curfews, and then they locked the reservations down, say from Friday night at 5 to Monday morning. And when I say locked down, gas stations closed. Grocery stores closed. I mean, everyone was to stay home. And I would be driving across the reservation, going from one hospital to another or visiting some of our volunteers. And people weren't out and about. They followed the advice of their leaders. And I think their culture is just different than ours. In our culture, it's more like, this is my right, this is what I want to do, and you shouldn't tell me what I have to do or can't do. But with our Native American communities, a lot of them don't even own their own land or house, because it's the tribal land, it's the community. And they have a concept of what the greatest good is, what's good for the whole tribe, for the whole community, not what is my right, not what am I allowed to do or not allowed to do, but what is the best for everybody. And I think that's the whole reason when they got the vaccine and said, let's all get vaccinated, people didn't object. They came and they stood in line and they got their vaccine, and luckily they're doing better than the rest, for the most part, better than the rest of the country.
You couldn't have said that any better. And here on this show, respect for other people is not political. It's just the right thing to do. So I appreciate you sharing that. That insight's fantastic. Okay, let's get back to it. Folks who are just joining us, I want to talk again about your need with the COVID Care Force. How can we assist here as a community, and how do people get registered to become a part of this force?
So the first step in helping us or volunteering is to go to our website, and there's a little registration form that gives us information about you. We will then follow up with you, contact you very quickly, and start talking about when you might be available, what's your healthcare profession, are you a nurse, are you a doc, are you a respiratory therapist, EMT, whatever. And we'll start the discussion about when you might go. And of course, volunteers have questions too. But anyway, registering allows us to put you on our short list, and then we know what we need and when. And we're constantly recruiting. Every day we know who we're trying to get, what types of professionals. We even have need for non-medical people. One of the things that we've been asked to help with volunteers for is staffing some homeless shelters. And helping in homeless shelters and soup kitchens that are now reopening, especially among our Native American communities. And so we have volunteers. For instance, we need continuous volunteers in Gallup, New Mexico, for a homeless shelter run by the Catholic Order, the Missionaries of Charity. That's Mother Teresa's group. And our volunteers there stay on site at the homeless shelter and help help serve the meals and help the men. So you don't even have to be a medical person to volunteer. You can be a non-medical one as well. But please go to our website and register, and we'll be in touch with you.
I'm so glad you mentioned that, because there's a lot of clinical people who want to help but feel like there's no place for them. So I'm glad you said that. All right. So again, we'll keep popping that up so you can jump on there and register and get more information. All right, Dr. Morsch, we'll get back with you in just a moment. We want to get to our community questions though today. Follow-up Friday. Our first one today: my granddaughter, who is fully vaccinated, was exposed to a teenager who tested positive for COVID-19. She's not feeling well. Should she be tested? Should she be quarantined? What are people supposed to do? Dr. Hawkinson, tell us.
Yeah, I think we discussed this a little bit this week. We do understand there are other respiratory viruses that are going around, especially RSV and other common cough and cold viruses now, especially since we've reduced our masking. But we've also said that certainly if you are exposed, I think the first thing you need to do if you are having symptoms is to get tested. So that is important to note. You should get tested. Should you quarantine? There has been kind of updated guidance now. Previously, if you were fully vaccinated, all you had to do was monitor for symptoms, and if you got symptoms, get tested. Now, if you are exposed and you are fully vaccinated, again, this just came out this week, if you are exposed and you're fully vaccinated, there is a recommendation of getting tested 3 to 5 days or even a little bit longer after that initial exposure. So that has just changed this week.
But should you be quarantining? Because I actually had that question on my way into work today, is like if I have a daughter who's not vaccinated because she's not old enough and I'm fully vaccinated and she gets it, what do I need to do?
Yeah.
Stay away from people, full quarantine? Or just monitor?
There's still, you still wouldn't do any of the quarantine per se. It's more of monitoring for symptoms, but testing at that 3 to 5 days after that exposure. But of course, that could change now. We are expecting the CDC to release some of that unpublished data today that helped them change their stance on masking and revising their stance on testing after exposure now.
All right, thanks for clarifying that for me. Okay, so do we know if most of the seriously ill breakthrough patients had the same vaccine, Moderna, Pfizer, J&J?
Yeah, I think going to that question, again, dealing with breakthrough patients or breakthrough infections, again, we know that these vaccines were created not necessarily to stop infection, because infection, again, is that virus at the cellular level just getting into your cells and starting to replicate. What these vaccines are for are to prevent the whole spectrum of COVID-19, from mild symptoms all the way up to severe. We don't have any good data on if it was people who just got one vaccine or the other. We have seen from some of our data in-house that it is all of the vaccines that people have gotten that have still come to the hospital.
All right, I'm glad this question popped up again, because I still hear this all the time. Do vaccines reduce transmission?
Yeah, great question. Early on, prior to Delta, that answer we would have said is probably yes, based on a few small studies looking at vaccinated versus unvaccinated people, looking at the viral replication in vaccinated versus unvaccinated, which seemed to be less in those that were vaccinated. Also, those real-world data and studies which show that there is maybe reduced transmission in households, overall reduced infections and cases. Now, unfortunately, I think that has changed just within the last 48 to 72 hours, where the CDC is now coming out and saying people that are vaccinated still can spread the virus just as easily, meaning Delta specifically in this case. But again, we are still waiting for that unpublished data set or slide set. We are expecting that today, so we will see what that says. But yes, initially when the vaccines were rolled out, prior to Delta, we would have said the vaccines more than likely significantly reduce transmission.
Dr. Morsch, you had something to add?
I think what we can say, and of course you've said it many times, but what we can say about those who have been vaccinated, that almost literally 100% of the people, at least 99% of the people that are hospitalized, that have serious COVID infection, that are dying, are those who are unvaccinated. So the vaccines, though they may not prevent us from getting a COVID infection, one you can say pretty confidently, but it's going to keep you from getting very sick, being admitted to the hospital, and dying.
Next question is, I'm curious about the safety of my 5-year-old and outdoor sports. Would it be best to not participate in sports right now?
I think that goes back to the question of outdoors versus indoors. I think we've always felt that doing activities outdoors, whether you're walking with friends or family, being outdoors, I think is pretty safe. We don't have a lot of evidence that there has been a lot of spread of disease in that activity itself, whether that's football or soccer or softball, whatever might be being played outdoors. Still feel that overall outdoor sports, outdoor activities are safe.
So the vaccine reduces the risk of serious illness. Do fully vaccinated people die of COVID-19? Are they otherwise healthy or sick with other chronic conditions too.
Yeah, I think Dr. Morsch had a very good point. The vaccines overall are going to reduce your risk of severe disease, hospitalization, and death. And we have seen that, and that has played out here at our health system, but also we've seen the data and the numbers nationally as well. Yes, but the patients that we have had that have been here and have been fully vaccinated do have comorbid conditions. They tend to be older. They did have significant conditions such as heart disease, which maybe were pushed over the limit due to the COVID vaccine, as well as COVID, the disease itself, not the vaccine. Also, lung disease. A couple of our patients were severely immunosuppressed with blood cancer and chemotherapy. So the patients that we have seen that have had bad outcome or death, although vaccinated, did have those significant comorbidities as well.
I took the J&J vaccine. If boosters are allowed, should I or could I get an mRNA shot?
Yeah, that's a good question. I was just emailing with some of my ID colleagues and some of the colleagues that deal with other immunosuppressed patients about that today. That has been a question that has also come up the last 1 to 2 days. Do we need additional dosing? So there is no specific guidance on this yet. Is it going to be safe to take these other vaccines? I believe, yes, it will be safe. We just don't have the data to support that at this point in time, whether it's J&J or the mRNA vaccines. If you did receive a Johnson & Johnson vaccine, it is more than likely going to be safe to get an mRNA vaccine. There was that study from the UK looking at Pfizer plus AstraZeneca, and if you remember, AstraZeneca is similar to the Johnson & Johnson vaccine. That is that viral vector. It's that adenovirus vector. What they showed was that those patients that got that mixed dosing maybe had higher antibody levels. They also had maybe a more robust T-cell response, think maybe due to that viral vector vaccine. So those questions are going to be asked. They are going to be investigated and answered, and hopefully we will have more guidance on if additional dosing is needed, when and how exactly should you do that. If you got the mRNA vaccines initially, should you get additional dosing of mRNA vaccine? Or should you get the viral vector vaccine? Or if you got the Johnson & Johnson viral vector vaccine, should you get an mRNA vaccine, or should you repeat it with Johnson & Johnson? So those are very good questions. We still don't have the full answers, but overall, I believe additional dosing is probably going to be safe. We just need the data to support that and give the final recommendations.
Question for both of our doctors. Would you send your kids to school this fall that does not require masks? Dr. Hawkinson, I know both of your kids are vaccinated. How are you handling that?
Yeah. At this point, it's hard to tell. The only thing I don't know what their school rules are right now. Last year, the schools were very good at masking. I think that would be difficult seeing the climate that we're in today with the more easily spread Delta variant. I think it would be difficult, but I do understand the extreme benefits of going to in-person schooling. I would try to advocate for my child to be able to go to in-person schooling as much as possible. But now, even though they are fully vaccinated, which I do feel safe with for them as individuals, if they do get COVID or Delta variant right now because of their full vaccination status, but we are learning more about Delta, and so I think that's going to play in. I'd still like to see some more information about Delta. I can't answer that question fully. I still have questions, but would like to see some of that unpublished data that hopefully is going to be released today.
Yeah, well, you're a parent, so we all have questions. And
Yes.
Kids need to be back in school. But Dr. Morsch, his kids are vaccinated. My kids are not. There's a lot of questions out there. Help us out.
Right. Well, I'm the medical advisor for some of our local school districts, and we're struggling with this right now. As Dr. Hawkinson said, the climate is so, in a sense, polarized, or people have strong opinions on masking or not masking, even vaccines. Of course, the biggest issue right now is that children 11 and under, say five-year-old kindergarten kids up to 11, the vaccine's not approved yet for them. Mm-hmm. And I think it will be approved soon. I think Dr. Hawkinson could enlighten us on maybe the timeline when that might happen. So when you're talking about 12-year-old kids and over, that's almost a separate policy because many of them have been vaccinated. I think in the United States, the current statistics are 12-year-old to 18-year-olds, almost 60%, 57% to 60% have been fully vaccinated. That's 12-year-old to 18. Of course, then there's different statistics. The good news for the older, 65 and older, my group, is that 90% have gotten at least one dose and 80% are fully vaccinated. But here, now you go to 5-year-old children to 11. What are their options? Well, the only options there to mitigate the COVID disease really is mask wearing. And it's just hard to make that leap for school boards after everything we've gone through. I think my prediction is that school districts will go into the fall with some less than conservative policies, perhaps masking optional and all of that. And I understand why they might do that. And then more aggressive testing and trying to make sure parents understand if your child is sick or has symptoms that they should stay home. Of course, some parents will say, well, if you're not going to require masks, then I'm not sending my kids to school if they're 5 to 11. And so schools, I think, will have to have virtual options as well so that you don't force any group to do something that they don't want to do. But then as the fall rolls by, we're going to know better. Is this COVID, particularly the Delta variant, going to really wreak havoc with in-person school attendance, or are we going to be able to get through this? So I think the story is yet to be told. I think parents are going to have to make their individual decisions on their 5 to 11-year-old kids, depending on what the school wants to do. And I think we ought to admit, too, even masking is not 100%. Mm-hmm. So even if you require masks, what they're finding in camps this summer, summer camps and some summer schools, is that even when you really, really do everything you can to try to mitigate stop this virus, other than a vaccine, which again is not available right now for these kids, even then COVID can break in. And so they've had to close some of these camps and summer schools. So it's a tough question. I think parents are going to have to make their own decisions based upon their local school boards' policies and what their options are.
Yeah, not an easy decision. Dr. Hawk?
Yeah, I think that's a good point, too. You know, we have seen some of those events where people went to camps recently or summer schools, and they were able to trace hundreds of cases, 100, 200, 300 cases back to some of those things. And we do understand that when school was in session and some of those non-pharmaceutical interventions were in place, such as distancing as much as possible, good ventilation and airflow, and masking, that did improve the spread of the disease, and it showed that there wasn't spread in the schools because those things, not just one thing, but a combination of those things were taking place. I had to answer an email today because we do know that masking does elicit a lot of visceral emotions from parents and children, mostly parents. We know that children really do well with the mask. We've seen that this past year. Children are much easier able to exercise and do activity with masks. And also remember, if you are looking for references or information on who and why, the CDC has very good information for children and adolescents and what their recommendations are, and very good references to read. Remember, the American Academy of Pediatrics still recommends, number one, vaccination, but also in those spaces such as schools, those other mitigation strategies, just as you talked about, masking, distancing, good airflow and ventilation, doing all those things as much as possible, because we have shown that they have not spread the disease in those schools when those things are taking place.
So everyone took their masks off. Now hospitals are filling up with RSV and other respiratory illnesses. Is masking making us more susceptible to viruses in general?
I think that masking isn't making us more susceptible to viruses. I think that unmasking just allows for those viruses to be spread more easily. Not only is it unmasking, but it's lessened restrictions, such as lessened restrictions on group gatherings, people getting together more. I think it's more a consequence of that. It has nothing to do with our immune system being down because of wearing masks. It doesn't make us more susceptible. I just think that it's our behaviors that are allowing susceptible people to get together more, to spread the disease more. Do you have any comments, Dr. Moore?
Well, one thing you could look at is mask wearing must have been the reason why we virtually had no flu season this winter, influenza. And in the past, through October through, say, February or March, we were in the middle of influenza season, which is, if you're an ER doctor or a family doctor or a pediatrician, you're just getting slammed with patients who have influenza or the flu. And this year, it was almost non-existent. It was just incredible. And, you might, I don't know if any studies were done, but one thing you can say is we were all wearing masks, and that's probably the reason we didn't have a big influenza outbreak this year.
All right, recent polling shows a growing divide, here goes the political talk, between red and blue party lines. How do we change the narrative from politics to public health to get more people vaccinated and masked? Dr. Hawkinson, that's why we have you on every day.
Yeah, I'd like to throw this to Dr. Morsch, just because he talked about that with the Navajo Nation and their thoughts of not just for me, but what is best for the tribe or what is best for my community. And I'd just kind of like your thoughts on that first.
Well, we are who we are as a society, and we have our personalities, and we've developed. One of the things that made America great was this American exceptionalism, and the idea that we're free and we shouldn't have King George telling us what to do, and so that's why we have these United States of America, and that DNA is still in us. Our Native Americans, of course, have been here for centuries and centuries and centuries, thousands of years, and for whatever reason, their understanding of community and society is not exactly what the European idea is, that when we came to these shores. So there is a lot we can learn. I think this is a time for some humility. A lot of people have taken hard stances, very opinionated about whatever, and I still have lots of friends that have various ideas. And early on, I thought, man, I need to argue with everybody and beat them up if I have to do that, trying to explain what needed to be done. And I think perhaps this is an opportunity. I think as the weeks go by, I'm an optimist, and I think we will come back together, and we'll look back on this time as, why did we let ourselves get so spun up about how we approach this? Why did that happen? I like to see the whole vaccines issue as kind of, when they first came out, it was, we had an opportunity, and I remember since I was dealing with COVID in the front lines, and I thought I'd get it. As soon as I had that first opportunity to get a vaccine, man, I got it. If I had to drive halfway across the state like some friends did, get online and check which pharmacy had vaccines. I even signed up for the trial, the AstraZeneca trial here at KU, because I knew that was my earliest chance to get a vaccine. So in November, I did get my first injection. But now, vaccines are so prevalent, so available. So it's not just an opportunity anymore where you got to find. Now it's just an option. You just have to decide: am I going to get the vaccine or not? It's easy to get the vaccine. You don't have to hardly work at it. People even going door to door and asking you to make an appointment. I think, though, we'll come to a place like the Navajos did, like the Chickasaws did, like many groups did, where we're going to say to each other, this is not just an option anymore. It's an obligation. We have an obligation to each other. We have an obligation to our children who are unvaccinated. We have an obligation to people among us who have chronic medical conditions, that we should do everything we can, whatever we're asked of by our leaders, particularly the science, the people on the science side of our leadership, from the CDC, from the National Institute of Health. And if these consensus guidelines are things that be we don't like or are inconvenient, we should still do them out of respect for each other. It's better to be too conservative and take some chances and do some things. I shouldn't say take some chances, not take chances, and follow guidelines, even if they're inconvenient and we don't personally believe in them. But you know what? If it might help save another life, then I'm going to do that. I'm going to put myself out there. I'm going to wear that mask, even indoors. I'm going to social distance, and by golly, I'm going to get the vaccine, even though I really don't like the idea of a vaccine. Remember, we got to get that vaccine.
I like your comments about obligation. That's true. And remember what Dr. Stites says, it's we the people, not I the person. And, the other thing is we are dealing with a pandemic on many fronts. It is a pandemic in general for COVID-19. We've been dealing with this. Now it's become a pandemic more of the unvaccinated than the vaccinated. It has become a pandemic of misinformation and disinformation and sowing division and sowing skepticism of authority. We in public health, medicine are only trying to help each other, trying to help ourselves, trying to help our community. This is kind of what we do every day. And so I think it's going to take it has to boil down to not being in those party lines and doing what is the science, what is the medicine, what is this showing me. Some people are still hesitant. I was able to help a nurse get vaccinated this week who was kind of a little bit hesitant. She was able to finally get in and do that. It's going to take answering those specific questions. Unfortunately, for some groups, it's going to take tragedy in their lives. Either they get struck with COVID or their loved ones or their friends do, and then they see and then they realize. Everybody's going to have to come to that realization on their own. Again, we've said coercion doesn't work. We need to keep giving our message of the science, of the medicine, of trying to protect you, your loved ones, your friends, your community. We'll keep doing that, and we will keep up to date as the science changes. We know it can be confusing because, as we have seen within these last 2 to 3 days, it's confusing. And I can understand how the general public can get tired of it and confused and upset. But we have to keep trudging on one step at a time, one day at a time, and keep delivering this message.
It's like vaccinating one person at a time.
It is.
Even just you mentioning that about the nurse.
In different ways. Yep.
Yeah, and it's how they get to where they need to be to get the vaccine. So we got to help them get there. Okay, last question. We're going to get to a couple community questions. We'll try to squeeze some in. Will this virus ever just go away? I think that speaks for everyone. Who wants to start? Who wants to give us the good news, bad news?
Should we try to say the answer together? 1, 2, 3. No.
No. We don't feel it will go away. What we would hope is that as we evolve or as the virus is with us, it may change into what we see in those 4 common cough and coronaviruses that have been with us for hundreds of years. Maybe it just becomes like a typical respiratory virus. At this point in time, on July 30th, 2021, it doesn't seem as that way. We still have a long way to go. But getting to that, as our children and our younger generations grow up, it might be something that we live with just like the normal cough and colds that we live with, but I think it's still too early to tell. Overall, I think we both agree it probably will not just go away.
Wish it would, and never say never, but history shows us that probably this is going to be around, but vaccines will be effective, and people will understand it, and it'll be behind us in a sense. My fear is what's next, in this world we live in. Hopefully we've learned a lot through this experience that won't be quite as bad next time.
Are you surprised that more people aren't running out to get the vaccine the way they were in the beginning? Are you surprised by that?
I think that vaccine hesitation, as Dr. Hawkinson says, actually it's more, there's a lot of vaccine resistance. And so I don't quite understand it, but it has surprised me. I mean, you just, every day on the news, you see the same story. Somebody's in a hospital in an ICU bed, struggling to breathe, and they put a microphone in front of them, and what do they say? oh, if I would have only known it was going to be this bad, I would have gotten the vaccine. Well, what does it take to help people understand it is that bad? And as you say, Dana, it's going to take perhaps a loved one or someone that's close to you. But it's ravaging, especially the Delta variant. This is the concern, I think, with about 90% of all the tests now, the COVID cases being Delta. This is a much more contagious, much more aggressive variant. And fortunately, the vaccines are effective against serious disease or death. But the vaccines are there, and I just hope people can if nothing else, we're just every day. There's just more and more people are getting vaccinated. Just keep chipping away, and all we can do is try to convince as many people personally, one-on-one, to get the vaccine.
So there's a difference between vaccine hesitant and vaccine resistant. Those that are hesitant
I think so.
just need to learn more.
I think so.
And keep chipping away at that and get them down off the fence. All right, Jill, I'm so sorry to keep you waiting. Hello, happy Friday. Can you unmute?
Thank you. Happy Friday to you. The first thing that I want to say is we have a lot of parents that are on the line, and they're asking about questions about their kids and if Children's Mercy is going to come back on. And the answer is yes. Starting August 9th, every week, every Monday, 1 week they're going to be on Monday and Wednesday, we're going to have infectious disease physicians from Children's Mercy to answer your COVID questions about kids and to join our great team that we have here too. So there's thing one. Thing two, Dr. Hawkinson, can you help Nicole? She has a question that I think, I'm going to read it the way she's written it, but there may be some problems with this question in maybe myth busting. I don't know. Is the transfer patient lottery currently running in the hospital, or is it completely closed to transfers? She's asking for a family seeking a transfer from the ICU in Pittsburgh.
Mm-hmm. Yeah, I don't have a very good handle on how we're getting transfers. I know that we get calls on a regular basis. We do have people who are fielding those calls 24 hours a day. Not sure about the lottery. I think the best thing to do is have that ICU physician call our transfer center, talk with our ICU physician. We do know that our hospital is really full, not only with those 35 or 36 COVID patients, but also just in general full because of normal routine medical issues that need to be treated. So,
is it a lottery though?
I'm not sure it's a lottery, but a lot of times we will get transfers historically for people that need just an upgrade of care or things that they maybe can't do at some of those other hospitals that we are able to do here. So I'm not sure if it's a lottery, but again, I'm not sure where our stance is right now on taking transfers, just because our health system, our hospital is so full with those 35, 36 COVID patients, but also those routine medical issues that we deal with every day and have dealt with even before COVID.
Okay, so sounds like I need to get somebody for a transfer so that we can talk about this, and we will. I will do that. Janet wants to know, how does social distancing play into this Delta variant? Still recommended 6 feet, or is farther away recommended?
Yeah, I think we've always said, again, World Health Organization has said 3 feet or 1 meter. Again, that's because they also have to deal with the world as a whole, and there are a lot of places where it is a little bit more dense. We in the United States started with 6 feet, but we've always said 6 feet is better than 3 feet. 8 to 10 feet is better than 6 feet. Social distancing, those non-pharmaceutical interventions such as masking and social distancing definitely do play a part and will always help reduce that risk of spread to you if you are further apart from people.
Rachel has concert tickets the first weekend in August to an outdoor concert. Hey, girlfriend, are you going to go to Garth Brooks? Because I am. And I think Jess is going too.
I am. I'll see you there.
All right. Here's Rachel's situation, though. She does have stage 4 cancer, and she's diabetic, and she has not had the first dose of vaccine. If she masks up, is she safe?
Yeah.
I've had 2 doses, and I'm masking.
I think more concerning is the fact that she is unvaccinated at this point in time, almost August, and those vaccines have been available for quite some time. I think it, again, is going to go down to personal judgment. Again, outdoors is better than indoors. What is that outdoor scene like? Are you going to be jammed in with a bunch of other people where you have to assume that there's probably Delta in that some of those people are infected with Delta. They may not even know it. And you have to assume that not everybody is probably going to be vaccinated in that situation. So I think in this case, understand where are you going to be standing or sitting, and then also, try and hold out as long as possible to make that decision, but really assess what is your risk and what kind of risk are you willing to tolerate. The first thing I would do is go today and get a first dose of vaccine at least. But that is what you are going to be doing as we get closer to that concert or that event.
Okay, so 2 more questions because we've had great conversation this morning, but time is passing. Anil wants to know, hey Anil, I know it's like playing whack-a-mole with all the COVID treatment stories, but have you seen any numbers on the Math Plus protocol out of Houston?
No, I'm not aware of that protocol. We can certainly look it up, but
All right.
Does he elaborate on what that is?
No, he doesn't.
Okay.
So we got homework to do.
Again, still with the in accordance with the NIH guidelines and guidance, really the only effective treatments that are recommended continue to be remdesivir, steroids if you meet that criteria, other immunomodulators if you meet the criteria, anticoagulation, and of course, if it's an outpatient, we can use the monoclonal antibodies. So we could certainly look into that, but I haven't heard or seen anything like that in any of the literature or the NIH guidelines at this point.
Okay, we do have a question on I have 2 more. I know I said that I had 2, but this will be 1, and then we'll have a final. Can you talk about the people? Sean Curry wants to know if a person tests positive for COVID, is it still 10-day quarantine?
Yeah, right now there is no change in guidance. If you are positive, it still remains that 10 days of isolation from symptom onset or test date.
All right, and then could we just clarify for the audience, because we have a lot of people who are asking about this latest news. They say, if I'm vaccinated, I'm just as contagious as the unvaccinated, ?
Yeah, I mean, that is a big question mark. So that is certainly what the CDC and Dr. Walensky have stated. That is why the policy or the guidance on masking has changed. Again, unpublished data. We are looking for that data set or that slide deck now, but reading the other media articles on that of people who have seen it, they do seem to be concerned. It does seem as if vaccinated people are able to replicate the same amount of virus, and it also seems like from tracing events for cases that there has been significant spread of the disease even from those vaccinated patients. So again, we are still waiting for the full release of that data set, but that is what we have been led to believe so far from the press releases and the interviews from the CDC.
All right,
Okay.
great questions. Oh, Jill, you have one more?
No, I just want to tell folks I'm going to be gone for a week, going to go on PTO next week. I will miss you.
Yeah.
I will be watching. So it'll be fun. I'm going to be safe. I'm going to be in Indianapolis with family, and we're driving.
Well, good. Yes, have a great. We'll miss your face in the morning, but we'll see you when you get back. Okay? We'll hold the fort down pretty well.
I know you will.
Okay. All right. Sounds good. All right. Let's get to our final thoughts today. Dr. Morsch, again, so glad you were with us. What do you want us all to know as we head out?
Well, the hospitals are filling up. We know that. In some cases, they're busier than they ever have been before. That means they need healthcare professionals, and the number one need is for nurses. Doctors are needed, but boy, you need 24-hour nursing care, especially in these ICUs. So we need volunteers. We cover all the expenses of those volunteers, and in some cases can pay a stipend. And all you need to do is go to covidcareforce.org and register, and we'll be in touch with you. Thank you so much. And by the way, Jessica and Dr. Hawkinson, the whole team, what a great job you all do, and what a great contribution to this whole COVID effort that you all have made. It's been terrific.
Well, we're glad
Keep
you're
up the good work.
Well, you are contributing, and we appreciate it. We
Thanks.
sure do. All right, Dr. Hawkinson, we're heading into another weekend. What do you have for
Yeah, I
us?
was going to say thank you. He's doing much greater work in those underserved areas that need it so much. So thank you, Dr. Morsch. We heard some people, we heard a question today of somebody who still isn't vaccinated. Please get vaccinated. We know it can protect you against the whole spectrum of COVID-19, from asymptomatic to symptomatic disease to needing hospitalization, going to the ICU, and even death. So please continue to get vaccinated. Get those questions answered. There are those resources out there, the local health department websites, the state health department websites, the CDC. Please go to those, get your questions answered, talk to trusted people, get those questions answered, get vaccinated. This is what will help us reduce cases, reduce hospitalizations and deaths, even from Delta variant.
And Dr. Morsch, I had the guys pop back up the COVID Care Force website and information. Just again, for folks who missed that, just tell them again how they get registered.
So the easiest is to go to our website at covidcareforce.org. Our phone number there, 913-489-7500, or email us at info@covidcareforce.org.
Fantastic. Thanks so much. And thanks, everyone, for being with us today. On Monday, critical care physician Dr. Damian Stevens is going to join us. He went to New York City back in the early days of this pandemic, and he compares what he experienced then to what we are now seeing here in Missouri and Kansas. And Dr. Stites, he's back on Monday with us as well. But today, he gets the final word as he reminds all of us to work together to fight COVID-19 by remembering these 5 things. Have a great Friday, a great weekend, and we'll see you back here Monday.
5 rules. Rule number 1, we the people. We're in it together. It's not either one. Rule number 2, do the right thing. Wear your mask, keep the distance. Rule number 3, be the bridge. The bridge to the better day, and it's not that far away. You can do this. Ask questions, seek answers. Always ask us questions. We're going to be here. Please ask those questions. We'll try to answer them in a calm and honest and straightforward way. And that's what we need to do. And it's fair to ask questions about vaccinations and masks, but then you have to believe the answers from science. And then rule number 5, those who laugh last. It's important for you to continue to take care of yourself for your mental well-being and your emotional health in this really difficult time. Those 5 rules. But it starts with we the people.